Hello, everyone, and welcome. This is Nurse Eunice with Florida Training Academy. And as we do with most of our practice CNA exam question and answer videos, we're going to give everybody about 45 seconds to join. So, hey, Sandrine. Hey, Marie. Good evening. Thank you all for joining me on a Friday. You all could have been anywhere and you chose to be here studying. So, I am so proud of you. Hey, Michelle. So, if you are new to our channel, if you would go ahead and put your name and maybe your location. If you're from another country, we welcome you. This test that we're going to be reviewing today is the Prometric Practice CNA examination. However, it's good nationwide. So whether you're taking your test with Pearson VUE or Prometric, basic care doesn't change based on the agency giving the test. And so we're going to be starting in about 15 seconds. Let's see who's joined us. Hey, Kador. Hey, Miss P. Hey, Portia. Good evening, everybody. All right, we're going to get started now. Oh, Kador, you're close. You're in Middleburg. Hey, Gloria. All right, so everybody, number one. A resident often carries a doll with her, treating it like her baby. One day she is wandering around crying that she can't find her baby. The nurse aide should A. Ask the resident where she last had the doll, B. Ask the activity department if they have any other dolls, C. Offer comfort to the resident and help her look for her baby, or D. Let the other staff know that the resident is very confused and should be watched closely. Oh, you all were fast with this one. Hey, Marlene. Hey, Sarah. Hey, Naya. Hey, Elise. You all are correct. The correct response is C. Whenever someone has end-stage Alzheimer's or severe cognitive deficit, meaning that they have severe memory loss, you trying to reorient them and tell her that, hey, this doll isn't your baby, isn't going to help the situation. The best response in this situation was to help her look for her baby. If you went to the activities department, because sometimes we try to be slick, and it's like, hey, let me just go get another doll. Maybe that doll has a red dress, but the doll that she loves has a blue dress. So she would know that you were trying to trick her. So just help her look for her baby, and hopefully that will calm her down. So great job, everyone. Let's go to question number 2. A nurse aide is asked to change a urinary drainage bag attached to an indwelling urinary catheter. The nurse aide has never done this before. The best response by the nurse aide is to A. Change the indwelling catheter at the same time, B. Ask another nurse aide to change the urinary drainage bag, C. Change the bag asking for help only if the nurse aide has problems, or D. Ask a nurse to watch the nurse aide change the bag since it is the first time. What do you think the safest answer would be? Yes, Marlene. Yes, Elise. Yes, yes, yes. Great job, everybody. The correct response is D. So, whenever you are hired, they're going to give you multiple papers, but you're going to have tasks. And a lot of these tasks are going to remain undone. For example, it may be like trach care. If you never have a patient with a trach, of course, you won't be taught, you would not have an opportunity to be taught the trach care. So whenever you're changing out a urinary drainage bag, that is something that a nurse should teach you how to do before you do it independently. That way you don't spill urine everywhere. That was the question that was on your test, Porsche. When did you test? And Michelle, you say you can't see it. I don't know why. Is anyone else having difficulty seeing the questions? Number 3, before feeding a resident, which of the following is the best reason to wash the resident's hands? A, the resident may still touch his or her mouth or food. B, it reduces the risk of spreading airborne diseases. C, it improves resident morale and appetite. Or D, the resident still needs to keep meal routines. Why do we wash the resident's hands? Renee, you're just listening in tonight. Everybody is correct. It is A. You all look at those hands. And so I chose a photo that had obviously, visible dirty hands, but your patients cough, they touch their body parts, etc. So before you feed them, make sure you wash their hands because not only could they contaminate themselves, they can contaminate their food. Beyond that, sometimes they reach up and touch you, so they could contaminate you also. Congratulations, Portia. All right, so Portia says that she passed her test 2 weeks ago. So if you all have questions, follow Portia, and you can inbox her and ask her some questions. Portia, let us know what city or state you're viewing from. Number 4, which of the following is a job task performed by a nurse aide? A, participating in resident care planning conferences. B, taking a telephone order from a physician. C, giving medications to assigned residents. Or D, changing sterile wound dressings. Which of those is a job task that a CNA can do? Marlene has it, you all. Marlene has the answer. It is A as in apple. And so a resident care planning conference is a big term for something small. You all, it's the meeting, it's the huddle. It's when we get together and we speak about these residents. And this commonly occurs in long term care facilities like assisted living facilities. The person who spends the most time with the patient or the resident is the CNA. So you're going to go in and tell us, how are they eating? If a facility allows diapers, are they running out of their supplies? But I'm going to backtrack because what you cannot do, according to most state statutes, is even if you do answer the phone B and there's a doctor on the phone and you write the order correctly, a nurse cannot take an order from a CNA. You're not going to be given medication, so C is wrong. And D, in most instances, CNAs cannot perform sterile technique. They perform clean technique only. So think about band-aids and boo-boos or procedures that you could use the gloves on the wall in order to perform. So great job, you guys and gals. Number 5, which of the following statements is true about range of motion or ROM exercises? A, done just once a day. B, help prevent strokes and paralysis. C, require at least 10 repetitions of each exercise. D, are often performed during ADL, such as bathing or dressing. And you all, ADL stands for activities of daily living. All right, all right, all right. I see a lot of D's. D is the correct response, you all. So we want to keep these patients as independent as possible for as long as possible. So we don't do everything for them. Even if they had a stroke on one side of their body, the unaffected side, we're going to get them to use the remote to maybe wash half of their body. So you want to allow them to, actually move whatever they can move. And whenever we perform range of motion, it helps to prevent atrophy. So whenever you think of atrophy, that is muscle wasting or muscle loss. It also helps to improve circulation. It helps with blood flow, so that person's going to be less likely to get a blood clot. So at no point should your patient just be in bed all day. Number 6, while the nurse aide tries to dress a resident who is confused, the resident keeps trying to grab a hairbrush. The nurse aide should A, put the hairbrush away and out of sight. B, give the resident the hairbrush to hold. C, try to dress the resident more quickly. D, restrain the resident's hand. Naya and Marlene, you have it. This is too easy for you all. Yes, this statement did not say the resident was combative. She is being distracted by holding the hairbrush. So you all allow her to hold the hairbrush with one hand while you dress the other arm, and then you could exchange the hands. If it's not hurting anybody, she can hold it. And as a reminder, my future CNAs and future nurses, a patient doesn't need a hairbrush to hit you. If this person was violent, you would have known this before you gave her the hairbrush. So just because someone is confused doesn't mean they're combative. They can just be pleasantly confused and distracted. So make your job easier and let her hold onto the hairbrush until you're done. Number 7, a resident who is lying in bed Suddenly become short of breath. After calling for the help, the nurse aide's next action should be to A, ask the resident to take deep breaths, B, take the resident's vital signs, C, raise the head of the bed, or D, elevate the resident's feet. A person is laying flat and they are short of breath. Looks like we have a few answers. Let's see if we get a few more. So, everybody, the correct response is C. So, great job. And I'll go back and I'll explain the other options in a few moments. But whenever someone is short of breath, without a chest x ray, without a nurse there with a stethoscope, I want you to automatically imagine this person's lungs being filled with fluid. So usually we'll say a person will develop pneumonia or fluid if they lay flat for too long. So after surgery, we usually have them get up and they start using their breathing devices, the incentive spirometers. So regardless of the reason that this person showed a breath, just automatically assume they have fluid in their lungs. And when you sit them up, the fluid travels to the base of the lungs, which will allow more air exchange to the upper parts of the lungs. And so I'm going to go back because you already called for the nurse. And then C was the second best response. You raised the head of the bed. From these options, which would be the next best response? You called the nurse. You raised the head of the bed. When I get into the room, what do you think I'm going to need? And if you said the resident's vital signs, you are correct. And so I'm going to put those in the chat. So you're going to have to learn how to prioritize care. So you call for the nurse. You raise the head of the bed. And then obtain the vital signs. I chose this image because the person has a face mask on, a non-rebreather mask, some type of oxygen device, excuse me. If the oxygen device is disconnected from the oxygen source, a CNA can reconnect it. But what a CNA cannot do is turn up the amount of oxygen because oxygen is a drug. It is a prescription as written by a doctor. So just keep that in mind. So you can put the device back on, you can reconnect it, but outside of that, anything else, you have to wait for your nurse to enter the room. Number 8, a resident who has cancer is expected to die within the next couple of days. Nursing care for this resident should focus on A, helping the resident through the stages of grief, B, providing for the resident's comfort, C, keeping the resident's care routine such as bathing, or D, giving the resident a lot of quiet time and privacy. Someone's at the end of life. Yes. Great job. Great job. Great job. So the correct response is B, providing for the resident's comfort. Usually we will consult hospice, and hospice can be done in the home care setting, in the hospital. It can be done in nursing homes, but usually the hospice nurse isn't there around the clock until death is imminent, like within 24 hours. So when you're providing the care, you don't want to leave them isolated. You do want to check on them, but you're not going to be doing heroics. For example, we're not going to force this person to get a bath every day, but we would do spot cleaning. So if they vomited, we wash their face and their chest, or if they used the restroom on themselves, we would clean their genital area. But you want to conserve their strength and keep them comfortable. Number 9, while giving a bed bath, the nurse aide hears the alarm from a nearby door suddenly go off. The nurse aide should A, wait a few minutes to see if the alarm stops. B, report the alarm to the charge nurse immediately. C, make the resident being bathed safe and go check the door right away. D, stop the bed bath and go check on the location of all assigned residents. You're given a bed bath and an alarm goes off. What's your priority? Oh, you all are winners. You all are doing so well with this test. The answer is C. You have to make the person that you're with safe before you leave them. And so, what do we mean by safe? If you're given a bed bath, honestly, a bed bath has no priority. You can always go back later and reheat that water and resume the bath. But you need to make the patient safe. If you have any side rails lowered, pull them up. If the person is undressed, you can throw the blanket or the sheet back on them quickly. And also make sure that the bed is at the lowest level. And then before you leave that patient, make sure you put the call bell in his or her hand. Then you can go out and check to see what the emergency is, and then come back and resume your bath afterwards. And of course, refresh that water. Number 10, gloves should be worn for which of the following procedures? A, emptying a urinary drainage bag. B, brushing a resident's hair. C, ambulating or walking a resident. D, feeding a resident. When should gloves be worn? For this one, which is the most contaminating? Yes, Miss P. Yes, Nadine. Yes, Marlene. Yes, Kador. The answer is A. Emptying a urinary drainage bag. And so, for those of you all who are studying online, I know you're going to ace the written test, but if you need assistance with the clinical, the hands-on test, we do have an Amazon store, and we also have our CNA exam prep manuals, the same ones that we have here whenever our students come to live in-person classes, that are available at amazon.com shop/Florida Training Academy. So we'd appreciate you if you would go there and make a purchase. All right, so question number 11. When walking a resident, a gait or transfer belt is often A, worn around the nurse aide's waist for back support, B, used to keep the resident positioned properly in the wheelchair, C, used to help stand the resident and then removed before walking, or D, put around the resident's waist to provide a way to, it should say a way to hold on to them. So I apologize. And since you can't see letter D, oh, Elisa, you got it. It is D. Who wanted to choose C? Anybody? If you were thinking about C, I want you to think about a walker, a crutch, a cane, any assistive device that a person would use to walk. You wouldn't give them the device, have them stand up, and then remove the device. So that is why C is not the correct response. You would keep the device on until the person had finished ambulating. And so we do have a video in our clinical skills playlist that shows you how to walk a person using a gait belt. Number 12, which of the following statements is true about residents who are restrained? Before we go any further, why do we restrain residents? We don't restrain people who fall. That's a misconception. If we're restraining somebody, that they must be a danger or a threat to themselves or others. So keep that in mind. This person, maybe they tried to overdose on drugs, they were unsuccessful, and so now they're in your facility and they are mad and angry. All right, so I'm going to go back and read number 12. Which of the following statements is true about residents who are restrained? They are at greater risk for developing pressure sores. B, they are at lower risk for developing pneumonia. C, their posture and alignment are improved. D, they are not at risk for falling. Yes, Naya, you're correct. We put those restraints on so they won't hurt themselves. Elise, give me a different answer. Miss Shu, it is A. Miss P is A. Millie is A. Maria is A. Great job. Shay, it is A. They are at greater risk for developing pressure sores. And it's going to make sense in a moment. You all, when we tie these folks down, they do not stay still. We tie them down, and imagine if it's somebody who may have been a victim of some type of abuse. And we tie them down, they fight for their lives. So it's not the physical restraint. It's not this, the 4-point restraints that calm them down. The 4-point restraints allow your nurse and your nursing team enough time to start the IV. We can give them IV fluids. If it's an older person who has a urinary tract infection, they get confused because of the infection. So it gives us enough time to start fluids and antibiotics. If it's somebody who tried to overdose on drugs, it gives us enough time to get the reversal agent. So you tying them down doesn't stop them from moving about. It's the chemical restraint. It's what that nurse puts in the IV that ultimately helps them calm down. And once we get them calm enough, we can start releasing the restraints. So they are at greater risk for pressure sores. They're at greater risk of falling because their goal is to get up. And they're also at greater risk of death. And you never want to attach a restraint or any device to a side rail. If you can look at the image there, you're going to connect it to the frame that the mattress sits on. So it always connects to the frame of the bed. Number 13, a resident has diabetes. Which of the following is a common sign of low blood sugar? A, fever, B, shakiness, C, thirst, or D, vomiting? All right, I got a few answers there. We'll reveal the answer in three, two, and one. That's right, everybody. It is shakiness. So they start feeling. Have you ever gone all day without eating? You get a headache, you just get the little tremors in your hands. That's a sign of low blood sugar. I'm going to go back. Let's talk about signs of high blood sugar. So, the reason why some of you may have thought it was C, thirst, is because whenever someone's initially diagnosed with diabetes, their blood sugars are high. Their symptoms are usually I'm thirsty all the time, I'm urinating all the time, I have visual changes, I have tingling in my hands and my feet. Let me go to the doctor. And that's when we find out they have high blood sugar. When the doctor prescribes an anti diabetic agent, either it's going to be a pill or it's going to be insulin, that's when their sugars can become low and they start feeling shaky. I have no chocolate to give you. All I have is nurse love. How much orange juice, if this person can still swallow, how much do you give them? 4, 8, or 12 ounces? So I'm your nurse. We've confirmed the blood sugar is low. This person can still communicate. They still have a gag reflex. And I say, hey, go get me some orange juice. How much do you bring back? 4, 8, or 12 ounces? All right, I'm going to start typing it in. Hey, Aja. Hey, Millie. Hey, Beyonce. It's going to be 4 ounces, you all, followed by protein. So if you notice on the units, they're always going to have peanut butter. They're going to have like turkey sandwiches. If we just give them orange juice, the orange juice is going to cause the blood sugars to rise, but they're going to crash again. So we're going to give them something that has real sugar in it, but we also need to give them something that's going to stabilize their blood sugars, which is why peanut butter crackers or a sandwich will help do that. Okay, then you'll be checking those blood sugars more frequently. Number 14, when providing foot care to a resident, it is important for the nurse aide to A, remove calluses and corns, B, check the feet for skin breakdown, C, keep the water cool to prevent burns, D, apply lotion including between toes. Don't do D. Grandma's gonna have a foot fungus. No lotion between the toes, so it's not D. Great job, great job, great job. You all, it is B. When you're providing foot care, if you see something abnormal, stop. Notify the nurse. Don't put soaps and lotions in an area that is already eroded because we can cause more issues. So if you see something that does not look right, stop the bath, bathing of the feet. Go ahead and let your nurse know. Number 15, when feeding a resident, frequent coughing can be a sign the resident is A, choking, B, getting full, C, needs to drink more fluids, or D, having difficulty swallowing. Renee, do you have a test date yet? Great job, Kador. Rosini, not quite. Great job, Elaine. Great job, Elise. So this one's a little bit tricky. The correct answer is D. When someone's coughing, that is not a complete obstruction. That's a partial obstruction. Our job is to encourage them to cough, to bring it up. Whenever someone is choking, there is no air exchange. So that's when there is a complete blockage. And you would simply ask, are you choking? Usually the person's going to have the look of doom. They're going to have their hands to their throat. You would go behind them as illustrated in the image there. You would take the knuckle of your thumb and go above their belly button and then cup your hand and do upward and inward thrust until the object is expelled. If the person collapses, whenever an unresponsive choking victim, if they become unresponsive, you immediately start CPR. So, of course, you're screaming out for help. If you've never practiced the abdominal thrust, aka the Heimlich maneuver, I'm going to give you a few seconds to practice it now gently on yourself. Make a fist with one of your hands. Take the thumb part of your fist and take that above your belly button. Cup your fist with the free hand and do upward and inward thrust. Number 16, when a person is admitted to the nursing home, the nurse aide should expect that the resident will A, have problems related to incontinence. In other words, they're wetting themselves. B, require a lot of assistance with personal care. C, experience a sense of loss related to the life change. D, adjust more quickly if admitted directly from the hospital. Yes, Tivella, you're correct. Yes, yes, yes. The answer is C. They may experience a sense of loss related to the life change. Imagine being institutionalized. You can still give yourself a bath, but maybe you're a brittle diabetic and you don't have family members who live with you. We can't send you home by yourself because your blood sugars could drop. We're going to have to put you in a nursing home so that we can manage your medications and help you manage your disease. So that person's going to have depression. And initially, they're going to start by maybe striking out at you, the CNA. I want you to not, take this too seriously. Just try to befriend this person and give them time to adjust to your facility. Number 17, a resident gets dressed and comes out of his room wearing shoes that are from two different pairs. The nurse aide should A, tease the resident by complimenting the resident's sense of style. B, ask if the resident realizes that the shoes do not match. C, remind the resident that the nurse can dress the resident. All right, what do you think the response is? Are you going to dress somebody because they have on shoes that don't match? Yes, Miss P. Yes, Naya. Yes, Renee. You're going to ask, do you realize that the shoes don't match? And so, the characteristics of aging. Whenever you watch TV, it shows a whole bunch of people who are confused. There is so much that happens as you age before dementia and Alzheimer's sets in. First thing is going to be visual changes. They can't see as well. Hearing changes. They can't hear. They won't have the same reach or the same mobility. So, as a CNA, I need you to be proactive. This person can dress him or herself. I need you to maybe, if you're working there at night, to pull out the clothes that they want to wear, including the shoes, so they're within reach. And that would help your patient be more independent and prevent them from wearing shoes that don't match again in the future. Number 18, resident's wife recently died. The resident is now staying in his room all the time and eating very little. You all, that's a sign of depression. The best response by the nurse aide is to A, remind the resident to be thankful for the years he shared with his wife. B, tell the resident that he needs to get out of his room at least once a day. C, understand the resident is grieving and give him chances to talk. D, avoid mentioning his wife when caring for him. Perfect, perfect, perfect. The answer is C. Understand the resident is grieving and give him chances to talk. And whenever we're talking about communication as it relates to healthcare providers, we're there to listen. And so you can encourage him to speak about his wife, maybe ask him a question and see if he will start opening up. 19, when a resident refuses a bed bath, the nurse aide should A, offer the resident a bribe, B, wait a while and then ask the resident again, C, remind the resident that people who smell don't have friends, D, tell the resident that nursing home policy requires daily bathing. There is no policy that requires daily bathing, just FYI. What do you think the best response is? Yes, perfect, perfect, perfect. The response is B as in boy. But I need you to go a step farther. This person refused their bath. Maybe it's because they want to watch TV and you came in at 9 a.m. and their favorite show is on. I need you to document the patient refused a bath. We'll offer again later. Now, the next time you offer, if this patient still refuses the bath, please let your nurse know. And now I need you to document patient refused bath at whatever time, nurse notified. Because I can promise you, when this patient's family members come in at 8 p.m., this patient's going to say, that CNA didn't offer me a bath all day. And so you want to protect yourself and protect your license. The reason why we give these residents baths daily is not necessarily because they have body odor. It's because we need to see their skin. We have to do a skin assessment because if there's a new scratch or something, the family could blame it on us. So that's another reason why I want you to notify your nurse because maybe he or she can go in and encourage this person to have a bath. Number 20, when a resident is combative and trying to hit the nurse aide, it is important for the nurse aide to A, show the resident that the nurse aide is in control, B, call for help to make sure there are witnesses, C, explain that if the resident is not calm, a restraint may be applied. Never warn them that you're going to tie them down. You give them a chance to get ammunition. D, step back to protect yourself from harm while speaking in a calm manner. They're combative, but I need you to be professional. What's the best response? I see a lot of D's. Yes, yes. Step back to protect yourself from harm while speaking in a calm manner. And she looks mad. I don't know what you all did to her. But protect yourself. I need you to make it home to your family members uninjured. 21, during lunch in the dining room, a resident begins yelling and throws a spoon at the nurse aide. The best response by the nurse aide is to A, remain calm and ask what is upsetting the resident. B, begin removing all the other residents from the dining room. C, scold the resident and ask the resident to leave the dining room immediately. D, remove the resident's plate, fork, knife, and cup so there's nothing else to throw. Do not choose D. If you get that close to the knife and the fork, you could get injured. So the response is not D as in dog. Yes, Rosini. Yes, Kador. Yes, Nadine. Yes, everybody. It is A. Remain calm and ask what is upsetting the resident. You all woo-saw. I worked at one inner city hospital. I would have 7 patients, and pretty much every shift, one of those 7 patients or their family members would curse me out. And so it was so common until one day I didn't get cursed out. And it was 6:55 p.m. and I was getting a brand new admission from the medical intensive care unit. And he was in the hall. He had Parkinson's and Alzheimer's. And he's still on the stretcher in the hall. And he has his tremors and he has his sheet pulled up all the way to his chin. And he looks up at me and he says, "You ugly mother." And you all I want you to do is just laugh it off. Do not get upset when these patients do things that are untoward. If they use vulgar language towards you, set the standard. And if it's something that you cannot manage, please let your nurse know. But don't get upset and don't abuse these residents. All right. So woo saw and keep it moving. 22. Yes, Marlene. I went all day without getting cussed out to get cussed out. 22. Which of the following questions asked to the resident is most likely to encourage conversation? A, are you feeling tired today? B, do you want to wear this outfit? C, what are your favorite foods? D, is this water warm enough? Yes, Shay. It is C, everybody. So when you're trying to encourage conversation, you have to ask open ended questions. An open ended question cannot be answered yes or no. So this is what I want you to think of it. When you were a teenager and you were mad at your parents and they ask, are you okay? You just say, yeah, conversation's over. So if you want someone to have an engaging conversation, don't ask questions that can be easily answered with a yes or a no. So C is the best response. 23. You're trying to communicate with a resident who speaks a different language. The nurse aide should A, use pictures and gestures, B, face the resident and speak softly when talking, C, repeat words often, often, often if the resident does not understand, or D, assume when the resident nods his or her head that the message is understood. You're communicating with someone who doesn't speak your language. Very good, everybody. It is A. Your facilities are going to have communication boards, whether it's a piece of paper that has images or it's a tablet. You all, there was a customer who kept calling who spoke Spanish, and this was a while ago. One secretary was so upset because the person kept calling and she said, no habla English, and the person would continue calling. The person actually came to the office. Still, no one here speaks English. All I did was use Google Translate. I used an app and I was able to help the patient. So there, not every app is going to be approved by your facilities. So you want to, make sure you check with your nurse, but usually they're going to have a piece of paper or something that has images and you can use that to determine if your patient's in pain, if they need to use the toilet, or if they need something to drink or something to eat. 24. While walking down the hall, a nurse aide looks into the resident's room and sees another nurse aide hitting a resident. The nurse aide is expected to A, contact the state agency that inspects the nursing facility, B, enter the room immediately to provide for the resident's safety, C, wait to confront the nurse aide when she or he leaves the resident's room, D, check the resident for any signs of injury after the nurse aide leaves the room. What's the safest response for you and your resident? What do you need to do? Yes, Elise. Yes, yes, yes. It is B, everybody. Enter the room immediately to provide for the resident's safety. Now, I need you to pass this test. So the correct answer for the test would be B. Anything else would cause more injury to the resident. We're not going to wait to contact the state agency, and we're not going to wait to confront that nurse aide. But notice in this image, I need you to call your team. Because if you walk into the room and I am hitting a resident, what's going to stop me from hitting you? And if you hit me back, what happens to your CNA license and your future nursing license? So I need for you to scream help. Get as many people in that room as possible, as fast as possible. That way you have witnesses. So yes, you entered the room, pass your test, answer it correctly for the test, but in the real world, don't get hit, okay? And I'm sorry I'm saying that. Someone's like, no, help your patient. I'm going to help my patient by calling for help. Because if you're in the room getting abused and beat up and you didn't alert anyone else, now we have you and a patient who's unconscious. And that's not safe for anybody. 25. Before touching a resident who is crying to offer comfort, the nurse aide should consider A, the resident's recent vital signs, B, the resident's cultural background, C, whether the resident has been sad recently, or D, whether the resident has family that visits routinely. What do you want to consider? Oh, Shirley, Rosini, Sarah, Naya, Tivella. You all are correct. The resident's cultural background. And so there are cultures where men who are not from that religion, they should not be touching that woman. So how do you offer comfort without touching somebody? Smile, make eye contact, be a few feet away, and ask, is there something I could do for you? Even though the response here said cultural background period. I've had patients who didn't want black caregivers. I've had black caregivers, who didn't, feel comfortable taking care of certain patients. So it doesn't necessarily matter the cultural, just the background of that person. So before you touch them, ask their permission. And if you feel uncomfortable, please notify your nurse. So guess what, everybody? We have completed 25 questions. So you did it. Great job. If you've not subscribed to our channel, please do so. Please like this video. Let's see, from next week, we have drug calculation or dosage calculation for nurses. We also have fall prevention for CNAs. And I think we also have another on infection control, and those were your requests. And then Renee, I know you sent an email, so I'll be following up to that email. Any questions, you all? Nadine, you're welcome. Kiddo, you're welcome. Shay, you're welcome. Michelle, you're welcome. All right, so if there are no questions, I'll be posting another video this weekend, but it won't be live. It'll just be part 2 to this video because it's 50 questions total. Good luck on your test, everybody. Have a great weekend, and I'll see you all next week. Blessings.